Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to have with us today Dr. Rosie Frasso, Professor of Population Health at Thomas Jefferson University here in Philadelphia. Rosie, welcome to the program.
Hi, thanks for having me.
My pleasure. So I know you're a methodologist, which means you wear many hats and can do all kinds of studies, which I think is great for our audience to see. But I also know that you have a passion for health equity and eliminating health inequalities related to poverty and other things. So tell us a little bit about your work.
Sure. Well, I feel really lucky to get to do the kind of work I do. Over the past few years, I've really leaned into this idea that researchers need to find ways to make their research more digestible and consumable to not only students, but the community at large. And the way I've been able to do that is to start to work with some artists around their interpretation of science. So, for example, I've been working for about 10 years with a fellow named Willie Baronet, and he's an artist that has been buying signs from people on the street to populate art exhibits. So he buys signs from folks that are asking for help. And we first met each other because I heard him on the radio and I reached out. And the work we do together involves adding qualitative inquiry into that work. So he'll sort of do his sign acquisition approaching people here and there and everywhere across the country, buying signs. And then I've done qualitative interviews with people that have sold him signs. And then together we've analyzed that qualitative data and we've developed these art exhibits that not only introduce the findings of our study to the people that come to the art exhibit, but they're in a room with these signs that have been purchased. And it gives people a chance to really think about poverty in new and different ways. So you can walk by one sign at a time in a city like Philadelphia, but if you walk into a room where there's 100 signs, you can't ignore the issue of poverty in our city.
So that sounds great and fascinating. Is the main theme of the signs poverty, or tell us a little bit more about the signs and the content of the signs?
Yeah. So the way I like to talk about it is, my colleague is an artist, right? So he's an artist and I'm a researcher. And when you're holding a hammer, everything's a nail. So he sees these signs as ways to sort of gather artifacts to create art. And I see them as data that tell us more about the experience of living on the streets in a city like Philadelphia. So we actually coded and analyzed the signs using common coding techniques to kind of categorize them into different groups. And for example, there's certainly lots of signs about mental health. There's signs about having lost your income because of health care issues. Several of the folks that we've purchased signs from and interviewed struggle with substance use disorder. And they're very open about that, not only in their signs, but in our interviews. And there's other challenges that folks face around, how they landed where they are and what they're looking for and need. The goal of our first project was to really get at how people treat folks that they pass by, and this issue of dehumanization, of folks living in these conditions. I mean, poverty and living on the street is a very complicated issue, so we're not going to be able to disentangle all of that today. But there's lots of reasons why folks land where they do. But how they're treated by those that pass them by was our original research question, with the goal of perhaps providing a space for people to really think about their biases against those that they see. And I work a lot with medical students who are going to treat and care for folks when they show up in the emergency room, after, running into some complications related to living on the street and its impact on health.
So, as I listen to you describe your work, that's fascinating. Obviously, forgive me, it just makes me think of the pandemic and the dehumanizing impact that also had. Are you able, in your qualitative work, to examine the impact of these signs in terms of changing viewpoints generally, and or the impact that the pandemic had on people's separation, if that's a fair way to frame the question?
Yeah, I mean, othering is what you're talking about, right? We
Sure.
do a good job of othering folks. It's as we walk down the streets of Philly, it's pretty easy to distance yourself from someone sitting on a corner asking for help. So the way we've tackled the question that you're asking is we've circled back to people that have visited these exhibits to say, hey, you came to this exhibit 3 years ago. I'm wondering, have you ever thought about it again? Have you changed any behavior towards folks living on the street? Has it affected your outlook? And our first study did that with a very small sample of folks. We were able to follow up 2 years after an exhibit, and they said quite clearly, in no uncertain terms, absolutely. I stop, I say hello. Sometimes I give money. Sometimes I buy a cup of coffee. Other folks have said, it's changed the way I think about poverty. It's changed the way I think about the humanity in those I walk by. But that study design was a little accidental. And we wanted to really make sure that we're tackling that question of whether art can be used to infuse empathy in those that are exposed to it, especially around issues of poverty. So we're replanning this, and my colleague and artist is going to do an exhibit at the Muda Museum in January, and we're going to embed some qualitative inquiry into those visitors who come through that exhibit, follow up maybe 6, 9, and 12 months after they've seen it to get a sense of whether it's changed their perspective. It's also been useful in sort of our support of medical students and nurses and future clinicians doing work like this. So not only are they reading a paper, like a scientific paper that explores and codes and analyzes data that we collect, and they have this memory of the art exhibit that's, I think, a little stickier than just reading about it. We've done similar work around victimization and sort of stigma against people that are victims of sexual violence. And, so using these approaches to tackle these issues of empathy in multiple ways.
Sure. So I wonder, qualitative interviews and getting that information is so critical to sort of understanding the core of a problem. Is there a movement or a direction toward more empirical approaches at a population level? I mean, you're a professor of population health. So to understand the structural changes that need to be made via or vis-a-vis signage or anything else that might help move people's thoughts in a better direction?
That's a great question. I mean, certainly, I think, we do qualitative work very rigorously and, use very concrete approaches to data collection and analysis. But I think sample size is always a challenge. And there's issues of selection bias that also are, come up for quantitative work too. So I think one of the things that qualitative work can do can inform the development of measures or survey instruments that can be dispensed more broadly to follow up with folks over a certain period of time. And that's something that we're thinking about how best to do with this bigger approach at gathering information, certainly around this issue of poverty and signage use. I hate the term panhandling, but that's sort of the expression that's used in the literature. But this notion of waving a sign and asking for help, what does that mean, and what does it mean to both those that pass by and those that are doing it? Yeah, so I think some broader attempts at data collection are definitely something we're considering, and using the qualitative work to inform those.
Great. And with a minute or so left in this part of the segment, what do you see as next steps of your work, either in terms of policy application, policy change, and or other empirical work?
So I think for me, it's been a bit of a focus on future providers and clinicians. We tend to beat the empathy out of the healthcare workforce. And I think finding ways when people are going through the process of becoming PAs or nurses or physicians, that really infuse an ability to hang on to that empathy that brought them to the field is really important. So that's sort of been the focus around how can these approaches be augmentative to education at education interventions, so that the future workforce is really prepared to stay empathetic towards those they serve. It's hard. Jefferson does a lot of work around Jefferson does a lot of work around empathy and how do we maintain that. People come to medicine, for example, very empathetic, and by the time they're done, in many places, we beat it out of them. And my sense of this is that maybe this interaction and infusion of art into sort of traditional inquiry and dissemination might be something they reflect on differently with time than they would other pieces of information that they have to process as learners.
Sure, that's such a great point, actually, and a good point to end on. We're going to take a quick break. When we return, Dr. Rosie Frasso will tell us a little bit about her undergraduate experience and her life experience, and how that set the stage for her having such a great career. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
You can now watch MNN, Brick TV, QPTV, and SIC TV on BronxNet. Tune in to BX Omni, Channel 67 Optimum, 2133 Fios during most Sunday evenings. We'll show you some amazing content from our friends at Manhattan Neighborhood Network, Brick TV in Brooklyn, Queens Public Television, and Staten Island Community Television. Every borough represented in the Boogie Down. Epic partnerships for the ages. And catch our new Next channel, produced in partnership with MNN, 24/7 on BronxNet Channel 952 Optimum and 2138 Fios.
Most hiring algorithms would scream me out.
Some bosses couldn't see me as a leader.
I've run this place for 20 years, but I still need to prove that I'm more than what you see on paper.
I've been running code as long as I've been able to reach a keyboard.
This is what I do. It's second nature for me, coordinating 100 details at once.
It's the way my mind works. I have a very mechanical brain.
I sold them on my skills.
You gotta be so good they can't ignore you.
My magic is
Analytics and empathy. That's how I'm getting clients. You have to have the confidence in yourself to show up and defy the odds.
I am more than who I am on paper.
I never got a college degree. And today, I'm the CEO of my own company. People want to tell me I'm one in a million, when actually I'm one of millions. Stars are all around us. It's time for them to shine.
Even though we didn't grow up together, he's my favorite brother.
Hey, sis.
I'm the baby of the family, and he's the gentle giant.
What you know about Port Georgia?
Man,
Champagne, please. That's a classic.
You know when they say people are a rare breed? Yeah, he's that.
I'm sorry, I'll be back in a few hours.
Don't worry, Shug, you know I'm for you.
I know.
Go get the football.
That was my favorite memory. He was always for you. This is a true story of me, Bridget Floyd, and this guy, George Perry Floyd Jr., my big brother.
How do you know when you've made the right decision? It's the feeling you get in your gut. The one that tells you what's right or wrong. It's the one that says, sure, I can have a drink. Or the feeling that says, okay, I've been drinking. Now what? It's the voice inside you that says, I'm buzzed. Better leave the car when it's time to go. Plan ahead. Catch a sober ride. Buzz driving is drunk driving.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. Rosie, we always start this part of the segment with the exact same question, which is, tell us where you were born and about some of your formative experiences.
Well, definitely atypical story I'm about to tell. So I was born outside of Boston in a small town called Winthrop by the sea. And I had a very atypical educational journey. I was groomed to sort of take the lead in the family business. So my dad was a butcher, and I worked in the meat market for a long time as a kid and a young adult, but really wanted to go to college. And my approach to this got a little bit derailed. My parents didn't have a college education. My dad had only been able to stay in school till 8th grade. So I ended up in community college. I was trained initially to be an X-ray tech and loved that job. I loved being involved in healthcare and taking care of patients and being part of that. And I was able to move up the ladder. I worked at a big health system in Boston called Brigham and Women's, but all my colleagues had bachelor's degrees and they had maybe even MBAs because I was a chief technologist at that time, and I wanted to go back to school. So I stepped away in my late 30s to go back to college with 2 little kids in tow. And I was an undergraduate at Wellesley, and didn't look like my classmates, but they had a program that allowed women whose education had been derailed to re-enter. And when I was there, someone suggested I apply to graduate school, and I thought that was outrageous. No one in my family had ever done that. But I gave it a whirl, and I ended up at Harvard, at the Harvard School of Public Health. When I was at Harvard, they suggested I get a doctoral degree, and I thought that was outrageous. No one in my family had ever done such a thing. But I applied, and miraculously, I was admitted. And I ended up relocating to Philadelphia and finishing my doctoral work at the University of Pennsylvania. So very atypical story. I'm a butcher with X-ray tech who ended up with a PhD. So not the common story. I guess my message would be stick to it, because education is amazing, and you don't have to be a typical student. I was not a typical student or scholar.
What a great story. That's fantastic. And starting out as a butcher, you can't write it. I think that's pretty cool. When you made that transition from the potential leader of the family business into higher ed, what was your family's reaction? Obviously they might have been surprised, they might have been concerned, they might have been thrilled. I could think of 42 different responses. What was their response?
I think I have to sort of think a little bit about my dad. My dad taught me everything I know. He was a brilliant guy that never got an opportunity to get an education. And I think probably in his mind, it wasn't something that was achievable by our family, that he didn't really think it was possible. So I think they were skeptical, when I said, well, I'm going to do this thing. I really wanted to be a doctor, but that felt way out of my reach. And I had missed a lot of high school because, I worked on Fridays in this meat market, and I missed school. I barely had enough days in school to graduate, so it was a little bit of a tight squeeze at the end. And, it was, I don't want to say they weren't supportive, but they didn't know how to be supportive. I would say that. So I kind of went against the rails. I worked a bunch of jobs while I was in x-ray school. And at the risk of making this story sound even more crazy, I ran out of money and I wasn't going to be able to pay for the last semester of x-ray school. And I won the lottery. I bought a lottery ticket and I won like $4,000 in like 1982 or three. And I was able to pay the last semester. And x-ray techs were in high demand and I made a good salary and I just kept plugging along until I moved ahead.
Sure. What a great story. And just to be clear, the implication isn't that your parents didn't support you, but I think that your summary or your description is so important because it just as I hear you speak, it's obvious that they did support you, but what's critical or part of it is that they might not have fully had a sense of what you were trying to accomplish. And so it was kind of like an unknown territory that made it ambiguous for them and for your family. And that's a kind of challenge. That doesn't mean you're not being supported or that they don't love you. It just means that what does college mean and what is its value? These days, I mean, an undergraduate liberal arts education is under attack.
Sure.
And there could be plenty of first-gen kids out there that are sort of having maybe not exactly your journey, but like your journey, that it's like not traditional. And the parents might be, okay, we want to support you, but what are you going to do when you're done?
Yeah, what do you know?
And what and what your career has proven is that you had all these amazing opportunities by virtue of doing that undergrad degree and going to Harvard, going to Penn, getting your doctorate. That none of that would have been possible if you hadn't taken that initial plunge.
Yeah.
During the course of your education, undergrad or beyond, what were some of the elements of it that just kept you hanging in there and gave you the nurturing that allowed you to succeed along the way?
I'd have to say mentorship. I think when I was an x-ray tech, I worked at Brigham and Women's in Boston, and I also worked at Boston Children's. And I worked with this wonderful physician, scholar, who just said, if you want to do more, you can do more. And I thought, yeah, he doesn't really know how this works. Like I could never, what more could I do? I felt sort of amazed with myself that here I was, an x-ray tech. I had a lab coat and a job and a paycheck, and I worked with physicians that treated me with respect. And I was encouraged by this wonderful guy, Dr. Leibowitz, to think about what else I could do. And I did, and applying to Wellesley College, coming from my background, was way out there. It just seemed completely unattainable. But given that, meeting people along the way that provide that encouragement and just sort of give you time and recognition for what might be possible, I think makes a huge difference. And I really try to do that with my students. I'm very honest about being first gen. I mean, I have a ridiculous collection of Ivy League degrees that sometimes I look up at them and I'm stunned myself. How did I get them? This is insane from whence I came, but I try to be pretty humble and honest about it. And I tell everybody that, this was not a straight trajectory for me. It was not the traditional path. And, there's a lot of people with PhDs that just have never had a chance or didn't have to work the way I did to get here, which is fine. But I want to find those students that did and make sure they know that there's an opportunity for them too.
All great. Tell us a little bit about what was your undergraduate major at Wellesley? And what was your
gosh. So I had a sort of self-defined major. I think it was women's studies and medical ethics. It was sort of like one I created. And, again, just exposed to some people there that said, you should apply to graduate school. And if you could have seen my face when someone suggested that, I thought it was a miracle I was getting an undergraduate degree. So the thought of applying to graduate school seemed insane, frankly. And then be encouraged to apply to Harvard, which I thought, like, this is not worth the stamp I'm sticking on this envelope. But in the end, it worked out.
So clearly, I mean, a definite wonderful theme in your narrative is that at each step, you had aspirations that were supported by mentors,
Mhm.
and then it worked. Like it actually came to fruition. If you were to give, so a big part of this program, we're reaching young people in New York City, we're reaching young people in Philadelphia, and I think a lot of young people in urban settings may or may not be thinking of college as an opportunity. And I think for many of them, it's not that dissimilar from your background in the sense of it just didn't seem achievable.
Mhm.
If you were to give some guidance to those young people, what would you say?
Don't be afraid to reach out, to reach out and share your concerns with folks that are in academia, with professors, with teachers, and try to find that mentor that will help you along the way. And everything is achievable. I mean, it takes a minute, and it may not be a traditional path. And just be thoughtful about being creative in what your journey could look like, or open to what your journey could look like. If I never could have guessed I'd land here, sitting in this office, doing the work I get to do, the privilege I get to have to amplify voices of folks that are often unheard, and use my skills to do work that I hope makes a difference. I never could have imagined it, when I was 18, 19, 20. And I thought many times about giving up. I remember, finishing my PhD. I had a wonderful mentor. I mean, I looked at her and I said, "This is ridiculous. It's taken me forever. I'm going to be 44 when I finish this degree." And she said, "Well, you're going to be 44 anyway. You might as well have a PhD." And it sounds trite, but it was a really powerful comment to me. I was like, "Oh, that's true. So why not keep on plugging along, and don't let the traditional timeline distract you from your goals."
Yeah, that's so great.
Yeah.
And since you're talking to someone who got married at 46, I think it's fair to say that I kind of bypassed the traditional timeline, at least on that one.
Yeah.
I want to thank Dr. Rosie Frasso for joining us today and sharing her really amazing story. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. We'll see you next time. Until then, take care.